All right, you might need to get your blood pressure checked based on new guidelines released earlier this week by the American Heart Association. Nearly half of all Americans are now considered to have high blood pressure. Dr. Neal Sawlani, a structural heart cardiologist at Advocate Hair Institute at Lutheran General Hospital, joins us now with more on what you need to know. Doc, thanks for joining us.
Thank you for having me.
Okay, so can you tell me about these new guidelines as opposed to the old guidelines?
Yeah, absolutely. So the new guidelines reflect what doctors and us as cardiologists have actually known for quite some time. We used to say that high blood pressure was anything over 140 over 90. And so what the new guidelines are letting people know is that high blood pressure actually starts at a blood pressure of above 130 over 80. So that's quite a big difference.
Now, does it differ between men and women? And is there age specific for some of this stuff?
Yeah, generally speaking, this applies to everybody. So it doesn't matter whether you're 40 or 75 years old. This is a new blood pressure guideline we want everyone to be aware of, and it's really to raise awareness. We want people to recognize what high blood pressure is, what the impact is, and then have that conversation with your doctor and figure out what it means for you.
So does this mean, Doc, that we all probably need medication?
You know, that's a great question. That's the most common question I get asked at the Advocate Heart Institute, and that's the same question I got asked just before coming out here. And the answer is this. We lowered the number for high blood pressure, but it doesn't necessarily mean everyone needs new medications. It means that we have to teach people what it means to be healthy, and then what that means for them, and then figure out whether or not medications are a part of that equation.
Now, what are the risks of uncontrolled high blood pressure?
Yeah, uncontrolled high blood pressure can be quite a scary thing.
Yeah.
So the most common problems are related to heart disease. That includes things like a heart attack, strokes, and that's where doctors, us cardiologists, get excited because we can prevent those heart attacks and strokes from ever happening by treating high blood pressure and getting people to lower it.
Now, Danielle and Felicia would say not working with me would be the answer to this, but what can you do to lower your blood pressure?
Yeah, well, that might be one solution. But, you know, if that doesn't work, diet and exercise, you know, those first and foremost are the things that we have to emphasize to our patients. So, you know, cutting the salt out of your diet, getting back to the gym. I know Danielle was talking about the winter storm coming through, and so it's tough around this time of year, but getting the gym membership, getting back on the treadmill, and potentially losing some weight and exercising are really the things that are going to help.
All right, well, Dr. Neal Sawlani, you make it sound so cerebral as you talk to me. You make me want to get my blood pressure checked. It's definitely something that everybody should be out there doing, is taking care of themselves first and foremost.
Yeah, absolutely. Getting your blood pressure checked, you can go to your sometimes local stores in the neighborhoods, if not your doctor's office, the Advocate Heart Institute. We really emphasize getting that blood pressure checked on your first visit and keeping an eye on it when you're at home. It's something that we want everyone to be able to talk about around the dinner table and be aware of.
The good Dr. Neal Sawlani, thanks for coming in early this morning and spreading some knowledge for us.
Thank you
really
for
appreciate
having
it. All right, for more information about the Advocate Heart Institute, go to advocatehealth.com/heart.